It is my pleasure to invite Zinzi Bailey, a member of the NOVA invited faculty from the University of Minnesota, who will talk about the importance of focusing on our common humanity in overcoming our structural health injustices. Thank you, Zinzi.
Thank you so much, Susan. And it's actually really promising that a lot of the themes that you've already gone into are going to come out in this very brief talk. So I want to thank you first for inviting me to speak briefly today about justice. And as Susan said, I'm Zinzi Bailey, and I'm an associate professor in the Department of Epidemiology and Community Health at the University of Minnesota. And my work really focuses on the health impacts of and policy solutions for structural and institutional racism, especially at the intersection of the criminal legal system and housing. And in my work, both the research component and the substantive creation work, the consistent goal that is persistent is health equity, right? And a lot of times it's used as a buzzword, but I think it really means something, right? So health equity is really achieved when every person has the opportunity to attain his, her, their full health potential, and no one's disadvantaged from achieving this potential because of social position or other socially determined circumstances. And while this is the goal, what we end up researching and studying, often in epidemiology in particular, is health disparities or inequities. And these are reflected in differences in length of life, quality of life, rates of disease, disability, and death, severity of disease, and access to treatment. But this does not mean that health equity is simply its inverse. So as I move forward in the work that I do and what I hope to develop in terms of narrative and in concrete examples is thinking about what health equity really looks like. And from a very broad perspective, health equity looks like equality in outcomes, not only equality in outcomes, but also equity in the process. And so a lot of times from a public health perspective, there's this idea of intervention and thinking about what we are going to do to address health inequities. And as we're moving towards health equity and addressing these health inequities, these interventions can be conceptualized as occurring upstream, downstream, or somewhere in between. And downstream determinants occur on individual levels, including individual biology, specific risk factors, and behaviors. And intervening on that level will help individuals, perhaps in a clinical context, perhaps in some other context, but it doesn't necessarily address factors upstream that drive patterns, read inequities in health behaviors, outcomes, and even biology. So going further upstream, we can find living conditions, which include physical, residential conditions, social environments, work environments, service environments. And we can characterize those in different ways. And so, for example, we can observe inequities in childhood asthma rates from a very public health perspective, and think about that in terms of a child who lives in public housing that is under-resourced to address common pests. That child is more likely to encounter asthma triggers and experience asthma attacks and require emergency department care or hospitalization. And often we call these conditions kind of the social determinants of health. And we can intervene on remediating one apartment or home, or increasing access to insurance to make care more accessible. But this is not really getting at systematic reasons by which public housing translates to poor built environment, and by which that family needs public housing in the first place. So the question that we are left with is, why are certain living conditions more prevalent among certain communities and not others? And what can we do about it? And often we see institutional inequities in the public and private sectors as well as in public policy, that they're driving this distribution of social determinants of health. And in our example, we can think of resource allocation for public housing and the absence of the universal access to a living wage being key factors that might drive the living conditions within public housing. However, we have to go further upstream to social determinants of health inequities, the systems of social inequities like racism, sexism, classism, heterosexism, ableism, so on and so forth, to see how access to resources and healthy living conditions are inequitably allocated across pre-existing hierarchies of power. But our goal is not just to study these kinds of pre-existing conditions of our systems, right? It's to sustainably drive towards health equity. So we have to think about ways to improve our communities further upstream so that we're not continually just working on the downstream results of a larger inequitable system without thinking about the interrelationships between all of us and thinking about how we move forward or how these resources are allocated and the roots of the inequities in the first place. And so I can think about from a solutions base that we can talk about structural racism, which is where a lot of my work focuses. We proposed 3 key structural strategies for dismantling structural racism: multi-sector place-based initiatives and investments, disruptions to key leverage points, and transforming our organizations. And so we talked about what that might look like, but the underlying foundation is what we did not talk about, which is the narrative around what's needed, which is relationships. So we can talk about the money and the resources, but we're able to get that if we have the relationships. We're able to listen to what people are saying, and getting to that structural change is going to require cooperation, solidarity, community organizing, movement, in order to recognize our interconnectedness. And without that, structural change is impossible. So we have created structures and systems. They are our nature in a sense, but we have a role in that. And what provides a scaffolding for systemic change is the relationships between people and recognizing our shared humanity. Thank you.